Today we want to talk about erectile dysfunction and how's it treated. You'll learn several of the prominent methods of treating erectile dysfunction, and at the end I'll talk about a method that I find highly effective for myself and that I've recommended for many men. This is Arnold Broad, and I want to thank you for stopping by and watching this video. If you have any questions about this video or any of the videos on my channel, simply give me a call or text me at 609-410-4790. I'd love to hear from you. If you have a desire to email me, then there's a link in the description below this video to an email form. If you're on a phone, to get to that description, you have to click on the little down arrow to the right of the title of this video. Now let's see what we have today. Now looking at ED, there's a number of causes of ED. It certainly can be mental or emotional. It can be stress related. It can be performance anxiety related. It can be you don't like your partner. You could be working 7 days a week, 10 hours a day, and you're exhausted. So those are factors. There's another factor of diseases of the nervous system, such as Parkinson's or MS, or if you've had prostate cancer surgery and had damage to the nerves in that area, in the prostate area, that will cause ED. But probably for 95% of the guys, ED is a condition of poor blood flow. And poor blood flow has been stemmed from diabetes, high blood sugar, high blood pressure, different heart disease issues, cholesterol issues, and metabolic syndrome. So there's a lot of things going on in the causation of ED. Now getting into the treatment, if you've gone to your doctor and you're saying, you know, I have these ED issues, what can I do? How does it work? What do we do about it? At least for the men that I talk with, the primary response from a doctor, and generally the only response from a doctor, is to give you a prescription for an ED medication, such as Viagra, Cialis. So that's pretty much the go-to answer at the doctor's office anyway. And what you're going to get there is symptom relief, and symptom relief is fine, except for the fact that most men, if they get symptom relief, and especially when they listen to their doctor, don't really look at the underlying cause of the problem. So when you're working on symptom relief, over time the underlying cause gets worse, and what you're taking for symptom relief stops working. So you either have to change medications, increase your dosage, or any combination of the above. So, you know, that's the go-to treatment for ED. In a more natural approach, one of the best methods is dietary, changing your diet into eating way more natural foods, way less processed foods, more fruits, more vegetables, natural grains, omega-3 fishes, fatty fishes, those type of things. Really good for your body, really good for your cardiovascular system, because ED is a blood flow issue, and the more you can treat your cardiovascular system, the better the blood flow is. Now, a really good diet for that is called the Mediterranean diet. It's all over the internet. You could just do a search for that. It's primarily fruits and vegetables and grains, light on the red meat, okay with the fish, and not so much onto the junk foods and sweets. But the problem with diet is, if you ever try to lose weight, change your diet, have done a New Year's resolution, it's just really hard to maintain. I like supplements, and one of the supplements that I'm fond of is something called L-Arginine. L-Arginine converts to nitric oxide in your body, And one of the things it does when it does that is it helps to heal the lining of your blood vessels so that you get better blood flow. And with better blood flow, you get better erections. So supplements are pretty easy to work with because it doesn't really require lifestyle changes. All it takes is going out and buying the supplements. Maintaining a healthy weight is really important in working with ED because as you gain weight, you also increase inflammatory response in your body, which does damage the lining of your blood vessels so that you start again having poor blood flow. Everything comes back to the poor blood flow issue. Again, lifestyle changes, just like changing your diet, changing your exercise patterns to lose weight, to eat less, exercise more. It's pretty difficult, as can be found by anybody who's tried to done that with a New Year's resolution. Now, I'm really fond of the supplement approach. I'm really fond of something called nitric oxide therapy, which is a supplement kind of cocktail that works great in cardiovascular issues, high blood pressure, cholesterol issues, but it really, really works great in helping with erectile dysfunction. I personally take nitric oxide therapy. I recommend it to the guys I talk with. And a really good video on nitric oxide therapy and some description of the product that I personally use is in the link to the nitric oxide therapy video below this video in the description. To get there, if you're on a cell phone, you have to click the little down arrow to the right of the title. Now, if you have any questions about nitric oxide therapy, about this video or any of the videos on my channel, give me a call or text me at 609-410-4790. I'd really like to hear from you. Now, thanks for stopping by today and watching this video. Have a great day, and here's to your good health.